Hi, I'm Dr. Omar Chohan. I'm one of the interventional radiologists at Great Lakes Medical Imaging. Interventional radiology allows physicians such as myself to treat patients using minimally invasive procedures that forgoes more surgical techniques. It allows patients to recover faster and sooner and gets them back on their feet. The thing that drew me to interventional radiology was the ability to use catheters smaller than a few millimeters to go into arteries and to go into veins, to go into various organs, and just provide a wide array of therapy just to get patients back on their feet. Anytime I treat a patient, they're like, "Oh wow, I didn't know this could be done. This is amazing. I didn't know that it could just be done with just using lidocaine outpatient center." We're easily accessible. We are using evidence-based medicine to provide minimally invasive treatments for your patients. We are available 24/7. We want to be in direct contact with you. We'll provide you with our cell phone numbers, our emails. So if you have any questions or concerns about patients that you think would require our services, we're here for you. We want to be part of your team. We want your patients to get better. One of the examples that I recall most fondly was helping one of the primary care doctors who had called our office and asked us, I have a patient here that has leg swelling. There is an ultrasound that was done and it shows DVT. It's Friday afternoon. We've reached out to other doctors, but they said, we'll see the patient on Monday and put them on anticoagulants, and we'll see them after the weekend. I was reached out and I said, it's okay. Send him to the hospital. I'll take care of him that Friday. Patient came in, later that evening, stayed late, took care of his leg, got his leg to reduce the swelling, placed the stent, and he was home the next day. The benefit of having an interventional radiologist on your service is we do provide highly effective alternative therapies for your patients that would need treatments such as fibroid embolizations, prostate embolizations, or any type of biopsies or venous access. As we get towards his pelvis, we're going to be able to take a look at his prostate gland. There's a Foley catheter here since he can't urinate without one, and you can see it's relatively the size of a grapefruit. So my plan of approach in this case would be to access an artery here in the groin, and then once I'm in the artery, I'll eventually find the arteries that feed the prostate. And once I'm in those arteries, I'll deliver tiny little particles that would eventually over time shrink this prostate gland down and allow him to urinate freely without a catheter, and hopefully have less awakenings during the middle of the night to urinate. I'm Omar Chohan, one of the interventional radiologists at Great Lakes Medical Imaging. I look forward to being part of your patient care team. You can call me at 716-474-7503.